In this video we will discuss about facial simulation model, known as FaceSim. As you can see, this is a simulatory model which is going to mimic the various features of the face. This model has a movable base, a realistic Asian male skin, and beneath the skin is the deeper layers in the model. These layers have vascular, venous and arterial supply, which can very easily be seen in the model. In addition to that, we have the nerve supply, clearly demarcated by the white lines. It also has the cartilage and parotid glands depicted in the model. And if you feel the model, it will give you a feel of the subcutaneous tissue, as is seen in a normal human face. The model has been designed in such a way that over the bony prominences, subcutaneous tissue and fat pads can be felt as in a real human's face. The main objective of getting trained on FaceSim is to learn how various injectables can be given on a human's face without making any or minimum errors. The major advantage of having the vascular and the nerve supply on this face is while practicing the injections, one can locate where exactly his/her needle is pointing after the markings are done on the skin. This will give the practitioner an appropriate idea about how far he/she is from the vascular supply, and they can avoid such kind of vascular complications which are very commonly seen, especially with the use of fillers. It also gives you an opportunity to study the various anatomical landmarks that are usually seen on human's face. The bony prominences are perfectly made and highlighted like jawline. If we are doing fillers or face lift in this particular area, the origin or landmarks can very easily be appreciable, as well as the pathway for the various important arteries. The facial artery is very nicely depicted, where exactly it is originating and coming in contact with the jawline, and how exactly this is transversing on the face, and what all points you can avoid to decrease the chances of complications while you are doing the injectables. This simulator can be used to learn botulinum toxin and filler injections on the face apart from other techniques like skin boosters, PRPs, the thread lifts, etc. with the same model. Let's see how botulinum toxin procedure can be practiced on this face simulator. Considering you are treating a real patient's face, analyze the injection points and start with the markings on the face where the botulinum toxin injections need to be performed. You can use any erasable skin marker and ensure you clean the face skin after the practice for next training. The skin markers can be removed with water or alcohol swab later. Let's mark a line on the forehead, which is supposed to be the first line, to finger bits above the arch of the eyebrows. Start marking the lines in the similar fashion as we do in a real patient's face, about the markings of the various lines where exactly we want to keep the botulinum toxin injections. We can draw the lines in the mid-pupillary very easily in these models. For the purpose of demonstration, I am using the M technique here and marking the points on the forehead and the brows. Similarly, if you want to do the crow's feet, bunny lines, mark the same points with the help of a skin marker. Once the markings are done, we will use an insulin syringe for the demonstration of the botulinum toxin. Insert the needle to the 3/4 or almost full depth of the needle and inject 4 units of botulinum toxin into one point and repeat the same procedures on all the points marked initially. In the similar way one can practice different injection points for the crow's feet, bunny lines, smile line corrections, masseters and much more. One can feel the palpation of masseter at this particular area on the FaceSim module, because of the perfectly designed face. One can feel the softness of the tissue, indicating that there are fat pads, and the firmness will give an idea that you are possibly into the masseter muscles in this particular area of the face. To clean after botulinum toxin procedure, remove the face skin, the fluid will be present onto the surface of the inner layer of the model and wipe it with a tissue or a soft cloth. Put back the skin and the FaceSim is ready to use for the next. Let's see another procedure to perform fillers on FaceSim model. The depth of the fillers is always more deeper as compared to the botulinum toxin, and we have to go inside the subcutaneous tissue, hit the bone, slightly retract, and then do the injections at various filler points. This is very important because in a real patient, the fear of going into the artery or into the vascular supply is a major limiting factor, and at times people are hesitant in giving the fillers as compared to the botulinum toxin. Since this is anatomically perfect model, one can very easily palpate various points and bony prominences. Do the markings in a similar way as we did for the botulinum toxin. One can perform wherever they want to do the fillers, for the cheek augmentation, to give volume to the face, temples, or in the lower part of the face. All these areas are very easily palpable. If you have done the palpation in correct way, you can very easily notice where exactly the bony points are. If one wants to do the cheek enhancement by giving the volume to the upper part of the face, first do the marking of points and follow the standard injection techniques for fillers. The filler needle has to go deep, hit the bone. You will feel a very firm resistance to the needle, which will give you an indication where you have to stop your needle. This will be a similar feeling as you will get while doing procedure on a real patient. At this point you have to do a slight retraction, thereby injecting the filler into the face. Practice the same procedure on all the different points that were marked. A basic knowledge of the depth and the points is all you require while practicing on FaceSim. This is the best simulator to practice after your theory portion is over. Leave your book aside and practice as much as you want to achieve perfection. Another most important aspect while practicing on FaceSim is to find out whether you have hit an artery accidentally or not. Remove the skin while maintaining the position of your needle intact and visualize on your own. In this case, we are very near to a vein but have avoided penetrating in that vein. So this gives the trainer to analyze and give the real-time feedback to the trainee that he/she has to retract back and again put in the needle at some other place. In this way, the trainee is correcting the errors in a safe environment. How to clean the FaceSim after fillers? Fillers are more viscous fluid in comparison to the botulinum toxin. Due to properties of the high-quality grade silicone, the filler fluid that we are injecting onto the bone eventually comes out. In case it doesn't come out on its own, then you simply have to squeeze the area where the fluid was injected and wipe the surface once the fluid comes out. Practice and practice more, as many times as you want on the FaceSim model. Do the mistakes, learn how to rectify them on a simulator, and avoid doing such errors and complications while treating your patients. Treat your one-cent patient with full confidence. We hope you found the tutorial video on FaceSim helpful. For more such informative videos, please subscribe to our channel. Thank you.